Hello, my friends. I'm Dr. Emily, a urologist and men's health specialist with over 5 years of clinical experience, and welcome back to Dr. Emily 360. I want to talk to you about something that most men go their entire lifetime without fully understanding. A topic that sits right at the intersection of health, confidence, connection, and intimacy. A topic that makes some men blush, many men curious, and almost all men silent. But silence is exactly why so many relationships suffer. Intimacy fades not because passion disappears, but because honest conversation does. Before we begin, do me one quick favor. Go ahead and hit that like button, subscribe to Dr. Emily 360, and tell me in the comments where you're watching from. I love hearing the stories. Some of you watching from busy downtown apartments, some from small towns where everyone knows your name, some from retirement communities where laughter carries through the hallways, and some from quiet countryside homes where mornings begin with birds instead of alarms. No matter where you're watching from, this message is for you. Now let me share a truth that almost no one tells older men. Intimacy does not retire. Desire does not have an age limit. Passion is not a young man's game. Yet I meet men who have convinced themselves that once they hit their 50s, 60s, 70s, or beyond, they are supposed to fade quietly. They think they're too old for deep connection, or that their body is betraying them, or that the changes they're noticing are signs that their intimate life is meant to slow down or disappear. Gentlemen, that is not the truth. The real truth is that most problems in the bedroom are not caused by age itself. They are caused by small habits, misunderstandings, fears, and silent worries, things that can be changed, improved, or corrected starting right now. Your body is not broken. Your desire is not gone. Your intimacy is not over. You simply haven't been given the information, the guidance, or the permission to understand how intimacy actually works in a man's later decades. Today we're going to dive into one of the most misunderstood, taboo, and quietly stressful topics men ask me about behind closed doors. A topic that touches biology, emotion, psychology, safety, confidence, and relationship trust all at once. When men learn the truth, when they understand how the body works, what the changes mean, and how to handle them, they reconnect not only with their partner, but with themselves. I've spent years in clinic listening to men who were embarrassed to ask questions, men who felt disconnected from their partner, men who thought something was wrong with them because no one ever gave them a real explanation. But I've also seen the transformation that happens when these same men learn to communicate, to understand, to accept, and to approach intimacy with curiosity instead of fear. So today, I want to walk you through 5 major truths. 5 common mistakes men make when it comes to intimacy, fluids, connection, and communication. And by the end of this conversation, I promise you will walk away with a deeper understanding, a stronger sense of confidence, and the ability to create more meaningful intimacy in your life. And trust me, number 1 will surprise you more than anything. Let's begin. Men rarely talk about this, but one of the most damaging mindsets I see is the belief that vaginal fluids are dirty or something to avoid. Let's be clear, vaginal fluids are not random wetness. They are a complex, intelligent biological system created by the body with purpose. They come from 3 main sources: the Bartholin's glands, which release silky fluid that reduces friction and protects delicate tissue; the Skene's glands, sometimes called the female prostate, which respond to arousal by adding lubrication and antimicrobial enzymes; and the cervix, which produces mucus that balances pH, protects the reproductive environment, and makes intimacy safer. These fluids contain water, amino acids, minerals, enzymes, and lactic acid, a natural system designed to prevent infection, support healthy bacteria, and make intimacy comfortable. When a man thinks of these fluids as something messy, embarrassing, or dirty, it creates emotional distance. A woman may feel judged, rejected, or ashamed. And trust me, Women carry far more unspoken fear around this than men realize. Many of them have been made to feel too much, too little, too wet, not wet enough, not normal, or inconsistent throughout their lives. But here's the truth. These fluids are a sign of arousal, readiness, safety, and health. They are the body's way of saying, connection is safe. Intimacy is welcome. When you shift your mindset from judgment to understanding, you don't just help your partner feel more confident, you improve your own experience. Because a woman who feels accepted becomes more relaxed, more responsive, and more emotionally open. Intimacy deepens not through mechanics, but through acceptance. Now let's talk about something men are often too embarrassed to ask: taste and smell. I can't tell you how many private conversations I've had where a man leans in, lowers his voice and says, "Dr. Emily, is it supposed to taste like that?" Let me clear this up once and for all. Variation is normal. Just like no two men smell the same after a workout, no two women taste the same during intimacy. Hydration, diet, hormones, stress, medications, and even the time of the month all play a role. Pineapple, citrus, and water often create a lighter, fresher profile. Garlic, onions, coffee, and alcohol create stronger notes. Around ovulation, fluids often become smoother or more neutral. During menstruation or the days around it, there may be a faint metallic taste due to changes in blood flow and pH. After menopause, hormonal shifts may make fluids less abundant or slightly more acidic. None of this is strange. None of it is unhealthy. It is simply biology. The real issue isn't taste, it's judgment. If you make a face, criticize, or even pull away slightly, the emotional impact can be enormous. Women often internalize it as rejection, even if that wasn't your intention. But when you show acceptance and confidence, it creates a sense of safety that is far more arousing than anything physical. Intimacy is not a performance. It is an exchange of trust. Now, let's address something that should never be ignored: safety. Many men ask whether it's safe to engage in oral intimacy or swallow fluids. The short answer is yes, under the right circumstances. For healthy, mutually monogamous couples who know their status, the risk is extremely low. Vaginal fluids are primarily water, enzymes, and protective compounds. You take on more risk sharing a drink or kissing someone who has a cold sore than you typically do during oral intimacy. However, sexually transmitted infections can be transmitted this way. Chlamydia, gonorrhea, herpes, syphilis, trichomonas, and HIV are all possibilities. The risk increases if one partner has mouth sores, cuts, bleeding gums, or any open tissue. This is not meant to scare you. It's meant to empower you. Because the real key to safety is honesty and testing. I see couples every week who assume they are fine because no symptoms are present, but many infections have no symptoms at all. Getting tested together twice a year isn't a sign of mistrust. It's a sign of partnership. It says, I care about you. I want us to be safe. I am invested in our future. And that kind of emotional security enhances intimacy far more than taking unnecessary risks ever could. One of the biggest things destroying intimacy in long-term relationships is silence. Not illness. Not aging. Silence. A man notices a change in taste or smell, but doesn't want to hurt her feelings. A woman feels discomfort but doesn't want to sound unattractive. A couple stops exploring oral intimacy because of embarrassment rather than communication. Over time, the silence becomes a wall. A small misunderstanding turns into a signal of rejection. What could have been solved with a gentle conversation becomes a pattern of distance. You cannot fix what you cannot talk about. The body changes. Hormones, hydration, diet, age, stress, sleep. Everything affects fluids. If something smells different, it may be normal. If something smells sharply unpleasant, It might be a simple imbalance like yeast infection or bacterial vaginosis. Both common, both easy to treat, both nothing to be ashamed of. But neither of you will know unless you speak up. Encourage honesty. Make the conversation safe. Approach changes as a team instead of silently withdrawing. The greatest mistake men make, especially older men, is forgetting the emotional power of acceptance. When a woman feels fully accepted, fully embraced, and fully desired, her body responds naturally, her mind relaxes, her trust deepens, her arousal increases, her ability to let go, be vulnerable, and enjoy intimacy multiplies. Acceptance is the greatest aphrodisiac, the strongest performance enhancer, and the most powerful connector between two partners. When you show a woman that you accept her fluids, her scent, her taste, her body, her changes, her insecurities, her uniqueness, you create intimacy that lasts decades. You heal insecurities she has carried since adolescence. You create an environment where both of you can explore, play, laugh, and enjoy each other without fear. And in return, you gain a level of connection that no pill, no trick, and no technique could ever replace. So what do you do with all of this? Start with 3 simple steps. First, have the health conversation. Suggest getting tested together, not because you suspect anything, but because it's responsible and caring. Second, pay attention without judgment. If something seems off, suggest a refreshing shower together, encourage hydration, or support her in seeing her doctor if needed. Third, practice acceptance daily. Remind yourself that her body's uniqueness is not a flaw. It is an invitation. Her fluids are not something to avoid. They are a sign of health, connection, and trust. I know some of you may still feel a little shy or uncomfortable. But let me reassure you, every man has these questions. Every couple faces these changes. And every relationship grows stronger when communication replaces embarrassment. Safety does not ruin romance. Safety builds trust. And trust is the foundation of passion that can last well into your 60s, 70s, 80s, and beyond. Passion does not retire. Desire does not expire. You are allowed to experience deeply connected, satisfying emotional intimacy at any age. You just need information, intention, communication, and acceptance. If this conversation resonated with you, go ahead and like this video, subscribe to Dr. Emily 360, and share it with another man who needs this truth. And tell me in the comments, where are you watching from, and what topic do you want me to cover next? I'm Dr. Emily, and remember, small changes, real knowledge, and open conversation can bring confidence, comfort, and freedom back into your life. Passion does not expire, and neither should you.